So I would like to take next few minutes to introduce both of them. I'll start with Alan first. So Alan has spent 11 years working in the pharmaceutical sector, developing his sales, marketing, and management experience. He then enjoyed a further 10 years in the dental implant market. There, he continued in sales management before specializing in training and education. So, right now, he is working with VSS Academy as a managing director. And Alan's passion, enthusiasm, experience in education and training has led him to join VSS Academy. And I know that he is doing a fabulous job managing a lot, many tasks.
You're very
And
kind. Thank you.
so, and also like when he is not on VSS business, we can find him with his gardening passion and playing tennis and racquetball. That is
Thank
a
you.
great passion to pursue, I would say. So now I would introduce our speaker for today, Dr. Manoj Bhatia. So Dr. Manoj completed his education in India, BDS, in 1995 and his MSc in implantology in 2011. So Dr. Bhatia's special interest in dental implantology, and he has completed his diploma and masters in the same from the University of Central Lancashire and is an associate fellow of the College of General Dentistry. In addition, he has attended various advanced courses nationally and internationally, including the master's course in bone grafting and sinus lift from the University of Bern, Switzerland. Dr. Bhatia is one of only a few dental surgeons to hold a Master's of Science, that is MSc in implant dentistry. He has placed and restored many implants from the straightforward to a more complex cases, and that brings a very diverse experience in implantology, and one has a lot to learn from him when it comes to implantology. And also he's the course mentor for this course which we are going to discuss in today's session, that is clinical implantology for India by University of Central Lancashire. Sir has also his own company, MB Implants Limited, and he runs an implant mentoring program and has trained and supported many dentists and dental practices in the field of dental implantology. So, sir, we are looking for a very fruitful and insightful session today because your journey is truly inspiring, especially for all the Indian students who are aspiring to move to the UK. So, welcome to the session, sir. And
Thank you.
we are all very excited to hear a lot from you.
Thank you.
Right, sir. So, sir, my first question to you is that why you chose UK to pursue your dentistry in 2000, and like share your journey, like how from BDS you moved to the UK and pursued your MSc in implantology, and followed by that, I would also like to ask you that what has changed in dentistry in the UK in 2000 and like today in 2024, like what has changed in more than 2 decades in dental industry in the UK?
Okay, thank you, and hello everyone. So as Hillary was saying, yes, I've graduated almost 3 decades ago. Just sounds terrible when I say it like that. I finished my BDS from Bharati Vidyapit Pune, and they are now I'm very proud to say our clinical partner in India. So it's Bharati Vidyapit in Pune, who's the main lead clinical training center for the UCLan MSc in India. I finished in 95, then moved to Bombay. It's called Mumbai now, I believe. With my wife, we're both dentists, and we were practicing there for a good few years. I started doing implants really in 2001, but the point was implants are new. They've been there since the 70s and 80s, which, as far as dentistry goes, is quite new. Dentistry is going on for thousands of years. So when I got interested in implants, the people I learned from, they were amazing, but they themselves didn't know much about implants. They knew about oral surgery, but not necessarily implants. So we would stick implants in, lovely implants, left, right, and center, and they would work. As such, they weren't dropping out. We would try to put teeth on them, and the results were iffy. Sometimes they looked great, sometimes they didn't. You don't know what you don't know, and that kept bugging me. we didn't have, it was, for us, it was the half blind leading the blind. Um, and that was the worry. I wanted to follow a structured implant training program because we aren't taught implantology as undergraduates. And that is a big travesty. Our learning in implantology is just self-directed. We decide what we want to learn, and you only want to learn things that interest you. Surgery, sinus lifts, bone grafts. You don't want to really go down to the basics. Um, so I wanted to get it structured, and that's where this came in. So my aim of moving to the UK was not actually to relocate to the UK. It was to do my master's in implants, and that is how I came in to do my MSc in implantology. So that's answering in a very long about way the first question. How has dentistry changed in the UK? It has changed, well, considerably. You've got to take a step back. And dentistry in the UK is different from what it is in India. In India, dentistry is generally private based. You see the patient in your practice, you offer the best treatment you can, etc. Here, treatment is funded by, so the bulk of in dentistry in the UK is NHS. NHS is the body that gives out contracts to dental practices, and dentists will see patients and offer dentistry within this NHS contract. So they get paid by the NHS. They can also do private work. So all treatment isn't available on the NHS. Cosmetics, implants are not available at all. You will offer this treatment to them privately. And that's how it's been for donkey's years. But things have changed. Things are changing dramatically in the world of NHS dentistry. I know many of you have been hearing in the news, reading up about lack of dentists, lack of dentists. Yeah, there is a bit of a lack of dentists, but it's not just that. It is the NHS contracts. A lot of practices who have handed back their NHS contracts, for better or for worse. It's not that dentists don't want to work on the NHS. We really do want to work on the NHS. But the contract has become, for us clinically, untenable. It is more of paper pushing job than actually delivering good, high quality clinical work. A recent example is Bupa Dental, who have hundreds of practices all over the country, and they gave away 80 plus NHS contracts last year. That is massive. That is massive. They didn't close all these practices, don't get me wrong. They're doing private dentistry in most of them, if not all, but they handed back these NHS contracts. So the point is not just for dentists aspiring to come into the UK, getting positions, although there is a lack of dentists, but there's also a lack of NHS dental contracts, if that makes sense. So getting good positions is difficult, and there is a massive competition for that. So it's not that easy, is my point. And that is where I think additional qualifications, training, UK-based training goes a long, 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 long way, in getting good positions in the dental industry in this country.
Right. Sir, I would like to ask you regarding the pay scale, because for Indian students, I feel that money matters a lot. Okay, so how much one earn there after clearing their ORE, and let's say they are not doing any additional qualification, and they are, doing or joining as a general dentist, and someone who has done MSc in implantology, and what is the difference if they do the added masters on the pay scale, as well as the overall recognition and opportunities in professional field?
Pay scales are for dentists are generally good. Yeah, so dentists are well paid in the country. We are very, very, very fortunate to be well paid. So even a dental graduate who passes in the UK and they enter a dental practice as a vocational trainee will get a minimum pay of about 20 or 30,000 pounds, which is about 28 to 30 lakhs. And when they finish their 1 year training and they become full-fledged dentists, on an average, I would imagine at least you start with 45, 50,000, which is 45, 50 lakhs. It sounds a lot, or maybe it does, but 45, 50,000 sometimes doesn't take you very far. So the point is, a lot of people look at just the pay scales, but the expenses are also extremely, extremely high. Renting a small house, if you do it in London, rentals are easily 1,500, 2,000 pounds per month. That is 24,000 pounds a year gone, bank. So it's an expensive place. That is the issue. So that's one. With additional skills, implantology as such. Implants are well paid, very well paid. So a single implant tooth that we'd offer in general dental practice is about 2.5 to 3,000 pounds is the fee, which is 2.5 to 3 lakhs for one implant. So you can now imagine that it is a massive source of income. It is something that it's a game changer. You start multiplying by 10 or 15 a year or 20 a year, then suddenly you doubled your turnover, if that makes sense. So it's a big thing. People want implants. People are conscious about it, but people are not fools. They want implants from the right person. They will Google you up. They will check you out. Because remember, in all of this, there is massive litigation. Yeah, don't get me wrong. It's not a joke. Litigation can come anytime. And when
Right.
litigation does come, the solicitors will look at your training, your qualifications, etc.,
Right.
and so on and so forth. So employers also. So if you're a dentist working in my practice, and if there is a degree of litigation against you, they will also look at me. Why did you
Right.
employ that person? It's called
Hmm.
vicarious liability. So when people employ, if I want to employ you as an implant dentist or a dentist with a special interest in implantology, let me put it like that, then
Right.
I want to see your qualifications, your training, and you got to put that in a portfolio showing that. Um, and that's the important thing because we got to cover our backs when we employ you. That's the logic
Right.
behind it.
Right.
Um, and that is where all of this fits in.
Right. Right. And that with that, like I would like to add one more thing, that how difficult it is to get a job after clearing ORE part 1 and 2, and if you have an additional qualification.
Oh,
So
yes. Yeah, don't get me wrong, it's not easy. Everyone isn't getting picked up. That's not how it works. Again, people are careful with who they're picking up. Uh, uh, One question is, it at this point in time, in this environment, will you get a job if you pass ORE 2? Yes. Very simply put, yes. You probably will get a job somewhere. But there is a job and there is a good job. There are subtle differences, and you know that as dentists too. You want the right post in the right place for your family to develop and grow up. If you want to be in bigger cities, you need qualifications. You definitely need additional qualifications to do that. Hillary, I forgot the rest of your question. What was it? Got a part of it.
so sir, it is like how difficult it is to get a job after completing ORE part 2, and if you have an additional qualification, let's say in MSc in implantology.
If you have a UK qualification, whether it's a BDS or an MSc or a PGDip, it's a massive, it's a big thing. It reassures the employer big time. Your options open up. The job market is a different job market and a bigger job market for you. So with a UK-based postgrad qualification, it definitely makes you more attractive. You stand out of the crowd straight away without a shadow of a doubt. With ORE Part 1 and Part 2, again, for those of you who are thinking of immigrating to the UK, this is the path I followed also. In our time, there wasn't an ORE, it was IQE. We had three paths, 1, 2, and 3. And we had the same thing. There were a lack of dentists, perceived lack of dentists in the country. Jobs were there. Uh, but what people were doing was taking you on, employers were taking you on as dental nurses. If you passed, or in our time, it was IQE part 2, then you would get offered a position of a dental nurse. Um, Many corporates were doing that, and corporates are doing that even now. So if you are thinking of moving in and if you're serious about it, test the ORE waters and see if you can attend the part A and pass it. If you passed it, you show that commitment. Plus, you learn much. You learn a lot about UK dentistry while you're doing your part A also. You get an idea of what's happening. That is when you start communicating with prospective employers. Um, and for our students, we support you in that massively. So we have um, one of the biggest dental corporates in the country who have signed up for their implant training with us. So VSS Academy uh, runs the implant MSc program at UCLan. They also support the endo program, the MSc endo program at UCLan, at the University of Central Lancashire. But we're supporting, but this, the faculty, um, the VSS faculty run the MSc program at UCLan. That is where VSS comes in as an important collaborative partner. So VSS, and we would obviously support you. Having a job introduction and a reference is
Right.
massive. It goes a very, very long way. And that's exactly what we've done. VSS Academy has tied up with a big corporate to provide implant training for dentists within that corporate. And they are very, very keen to have our students, because for them, that's a lot of boxes ticked, even at ORE Part 1. Of course, at ORE Part 2, it's a completely different prospect, and an MSc to boot.
Right. All right, sir. So that is something which, anyone who is aspiring to migrate to UK should look for, like the post-course support and the kind of employment and the support related to that, which VSS Academy is providing you. And also you are getting a, degree from University of Central Lancashire, which is one of the top 10 universities in UK. And the degree from this university is, I'm sure that it is well recognized, and it helps the help you secure a job easily in the UK. So sir, what is your advice for overseas dentist considering moving to the UK? Like few things which you can say which they should consider.
Um, get onto the ORE boat as soon as possible. It's one thing to want to clear the exam. It's another thing to actually get the date for the exam, because that is difficult and not so easy. Look at your personal circumstances. Your circumstances might be such that you're happy to continue working in India till you finish your ORE Part 1 and maybe Part 2. So you might hop in and out to the UK to attend courses, ORE courses, etc. I know that there are ORE courses being run abroad and including India. But by all means, get onto these courses. Definitely sit the ORE Part A. What you then have to decide is, do you want to finish the whole ORE and then relocate to the UK? Or you want to move to the UK while you're doing your ORE? So that depends on your personal circumstances, etc. Because remember, if you do come to the UK and do get a job as a dental nurse pay is dramatically less. So how do you fund yourself is not so easy. Please don't discount that. Yeah, it is a difficult thing to do. What we would recommend also, if you're interested in the postgrad qualification at the same time, is hop onto that. So you have your PG degree being developed, you have your ORE that you're working on. So by the time you have reached a point of getting into ORE Part 2, got a date, etc., you're hitting the ground running. You got either a PG cert from the UCLan, you either got a PG diploma from UCLan ready to go, or an MSc. Any of these three are valuable. Obviously, the higher you go, the more valuable it is. Because remember one thing, there are very, 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 very few dentists in the UK offering implants. As simple as that. There are lack of dentists, yes. There are dentists trying to get into private world, yes. But out of that, implantology, there are very few dentists at this point. You will be, I don't know what the figures are. I don't know, Adam, that you have. At some point, there were less than 5 or 10% dentists in the UK offering implants. So there's a dearth, a massive, massive dearth of dentists offering implants. So you're very valuable. So I would say try and do both things together if it is implants that you are also interested in.
Right, right, right. It perfectly makes sense to me, and I hope that it is making sense to all our viewers or the aspiring candidates also. Sir, lastly, I would like to, throw some light on this course, which is on clinical implantology by UCLan, especially the clinical aspect of this program. And as you are one of the course mentor, I think you can, elaborate more on this, that, what are the clinical skills one will learn and at the end of this program, like how efficient they'll be in placing implants.
Okay. There are many courses out there, as I say, in implants. Are we the best course out there? Maybe, maybe not. But I could be biased if I say that. Uh, one of the things that you do when you go through programs like ours is you're able to judge for yourself, not just how good the course is, but various new things that come into the field of implantology. You could sit there and you'll be able to be empowering you with an MSc mindset. You know how to look at sources. It's a big market out there and a lot of information that comes every day. So I'd rather you be a proper implantologist, not an Instagram or a Facebook implantologist. That's the first thing. What does the course teach you? It takes you through the entire theory of implantology. It takes you through the hands-on. It takes you through the clinics. It takes you through the research. Um, it teaches you. It should be implant should be taught at undergraduate level, but it isn't. Even in the UK, it isn't. And ideally, there should be a BSc in implantology. This takes you. It's a combined. You're almost doing a full BSc and an MSc. It's a lot to take. You would hopefully, at the end of this, be a complete implantologist, and more importantly, a safe implantologist. When I say complete, I don't mean you'll do every case on the planet. Hopefully, you'll know
Right,
which cases to let go and not do. And that is more
right,
important in the cases you take on. We say it's, angels fear to tread where fools
right,
rush in. As far as the clinical bits go, what do you learn? We look at cases, implant cases. We look at cases at a straightforward, advanced, complex level, and we take you through that. You may or may not land up doing advanced cases. You may or may not land up doing the odd complex one. We're not sitting and promising you all of that. What we are promising you is doing it correctly. If you are able to, I'll give you an example, endo, do an upper anterior endo, central incisor endo properly, selecting the case properly, opening the access cavity properly, and maybe the wrong person to say that. The last endo I did was 8 years back. But extirpate properly, do your biomechanical preparation properly, obturate properly, crown it properly. And if you can do that for a central incisor properly, you can do it for a molar, you can do it for a lacerated root, you can do 10 endos in a day, you can do 20 in a day, and so on and so forth. It will teach you how to do implants properly, how to surgically manage it, how to prosthetically manage it. Students have through the course done, for those of you who want to know about advanced. Now, the advanced course, advanced treatment and complex treatment, we have to, at this point in time, defer that to your trainers also. Your trainers might think that, hang on, the student number A is struggling to raise a flap. Should he be doing a sinus lift at this point in time? And he might find student number B is so efficient at his thing that they might push you to the more
mm,
advanced cases. We're not holding it back. Yeah, we're not, but we're not going running around the country trying to look for all the sinus lift cases in the world. We're not doing that too. We are looking at the patient, we're looking at what's best for the patient, and if that patient then needs a simple placement, great. If he needs placement with GBR, great, we'll do that. If he needs graft first, wait X number of months and then place the implant, we will do that. If alongside the placement there needs to be a crestal sinus lift, we will do that. If a lateral is needed, we will do that. We will do what is right for the patient and what is at the right level for the student. And that is where a complete 15 clinical days comes into play. You got 5 clinical days in year 1, you got 10 clinical days in year 2, and you will do a good variety of cases
right,
in this thing. By the time you finish, as I say, you will know what to do, what not to do. You will also know what particular skill sets you're potentially slightly deficient in. And at that point in time, if you want to self-direct your learning and go on for this curry technique course 3 days somewhere, great, no problem. Now you're coming from a position of strength. You're not doing
right,
this because you saw it on Instagram. You now know exactly what needs doing. You know this kind of grafting technique needs doing, and I'm deficient in this. You can now go pick and choose and upskill in
right.
there, out there. So that is what I meant by a complete implantologist. You come as a complete implantologist from position of strength, from a knowledge base, a skill base, and you now know where to jump in and where not to.
Right, right, right. Also, a full CBCT training is included with this course, which follows UK standards,
Yeah,
and digital protocols are also taught, like related to
yeah,
implant dentistry and restoring the implant part. So that
yeah.
is also inclusive in this course. So
Everything.
yes,
Yeah.
yes, everything is included. So yes, that was fantastic, sir. Thank you so much for your time and sharing your knowledge and your journey with us. And I hope that our future candidates for this course will find it as inspiring as I found it. Also, thank you so much, Alan, for organizing and handling everything at back end.
You're very welcome. Thank you. I'm just want to put some contact details in the chat. So if anyone wants more information, they can WhatsApp Hillary or myself or email me. So, but thank you for your attention. Thank you, Dr. Bhatti, as well, for that. It was very, very interesting. Nothing I can add to that. So thank you.
Thank you. That's great.
Thank you so much, sir. Yes.